Once again, very good afternoon, and thank you very much for joining. My name is Natasha, and I will be your host on behalf of Elsevier this afternoon. Welcome to our webinar, Adopting Evidence-Based Practice to Drive High-Quality Patient Care. We have a very exciting webinar planned for you today, where we will talk about how it is very important to use evidence in your practice and how you can actually going about doing that using your current resources. Before we actually go into the session, I'd like to share some housekeeping rules. This webinar is being recorded, and a recorded version will be available on demand. So we will be sharing the recording link with all the registrants of the session. This webinar is happening in the Zoom webinar format, and we would strongly encourage audience participation. So it would be great if you could leave your questions in the Q&A box or in the chat box at the bottom of your screen. You're also welcome to chat with other participants via the Q&A box and the chat box. Most importantly, our host today, our speaker today, Dr. Yasmon, has some exciting questions for you, the audience, and he wants to hear from you. So we will be using Slido for the audience participation today. You can join Slido by visiting slido.com or and entering the event code 1988664, or you can simply scan this QR code, and we will be flashing this QR code throughout the session. So it would be great for you all to participate in Dr. Yasmon's research and provide your inputs. Thank you. And finally, we really value your feedback. So at the end of the session, we will flash a QR code and a link for you to share your feedback and comments. Please do remember to give us feedback, and that'll help us improve. So we look forward to hearing from you. And now, without much further delay, I'd like to introduce you to our very exciting guests for this afternoon. We have Dr. Yasmon from Faculty of Medicine, University of Indonesia. Dr. Yasmon is a lecturer and surgeon at Faculty of Medicine, University of Indonesia. He's also on the editorial board of the Journal of Indonesian Society for Vascular and Endovascular Surgery. I will not go into all the details, but I just want to highlight that Dr. Yasmon is a very prolific thought leader, trainer, as well as a social media speaker. So you should definitely follow him on Insta and look out for his other webinars and training sessions. Our moderator for this session will be Putri Prativi, also from University of Indonesia. Ibu Putri comes with over 15 years of experience as a faculty librarian. She has a lot of experience and knowledge on library management, and you can definitely ask her questions on managing resources, providing the right resources for your institution. So at this point, I'll hand it over to Dr. Yasmon and Ibu Putri. They have, as I mentioned, Dr. Yasmon has some questions for our audience. He has some insights to share, so I'll let them take the floor forward. Dr. Yasmon, Dr. Ibu Putri, all yours.
Okay, thank you, Natasha. Could you hear my voice clearly?
All good.
Okay. Good evening, everyone. Thank you, Natasha and Elsevier, for conducting this webinar. I won't be long, just as introduction. Natasha have introduced us before, and thank you for attending this webinar. As far you all know that this month we are celebrating the Patient Safety Month on the 17th of September. So this is a very great time for surgeons, especially to share what they have to conduct during the pandemic for the patient safety. So I won't be long. I will give to Dr. Yasmon to present his presentation. Please, Dr. Yasmon, the place and time is yours.
Hello, everyone. Hello, Ibu Putri, and thank you, Natasha, for the time. Before we start our talk about this adopting evidence-based practice from the Elsevier, I have actually a short survey. The survey is about the ClinicalKey, but also in the scope of, in the term of searching references in online. Okay, you can start slide.
Oh, the slide.
Okay, this is my disclaimer. So this is the opening of the quick survey. So I want to know about the online resources for students, and also not only from students, but also from the teacher, I mean from the lecturer and professor, and then also the consultant or medical staff, and also how the students elaborate the online resources in this online term. Okay, you can start. This is I have 20 questions, and then it's multiple choice and short answers, and the result is 32 responses. So it's this one is only thank you very much for the responses. This is 32 responses during 2 weeks. I made this quick survey in the 2 weeks, and I closed yesterday. Okay, you can start. Yeah, this is the first question. As a clinician, do you think you have to keep up with the latest medical information or knowledge to make a decision for your patient from credible sources? So there is 90% say yes, but there is also a person or participant that say no or maybe, because I don't know, in their mind, I think they don't have to have like a very yeah, they don't have to always look the online resources or medical information to make some decision about their patient. Okay, it's quite interesting. Okay, so what's your role in your Faculty of Medicine of University of Indonesia? So there's, I think, 1 or 2 professor from this 32 participants, and from medical staff also are 9%, but most of them is the 62% is medical are medical students. So yeah, we know that maybe it's not the same in each group. Slide. So almost 60%, yeah, this is around 20 and 25, so like the medical students itself. Okay, slide. So have you ever heard about the ClinicalKey from Elsevier? So 87% say yes, but 12% say no. So there is a I will show you in the next question about the cooperation between Elsevier with the University of Indonesia. Slide. Have you ever used the ClinicalKey feature? So because there's also 21% say no. Okay. Are you familiar with the URL of remotelib.ui.ac.id? This is like a this is a library from the University of Indonesia, but we can access it with our gadget or our laptop outside of the network of the University of Indonesia. So we can so there is 15% not familiar with this remote lib library of the University of Indonesia. Slide. So what's your favorite feature in the ClinicalKey? So there is 43% say journal, and textbook is 25%. So textbooks and journal is the most favorite topic in the ClinicalKey from Elsevier. And the third place in guidelines. So is we know that Elsevier had a lot of guidelines, like the previously information that shared by Natasha. Okay, slide. Okay, if you ever use ClinicalKey, tell me how was your experience in 3 or 4 words. So, okay, next slide, please. So I made with the bold line like a difficult to sign in because the remote lib error and buffering. Yeah, this is the network problem. Scientific, open-minded, very well managed, easy to understanding. One exclusively easy, systematic, and open. Easy searching. You can see that there is a simple but sometimes hard to find the intended content. And another is, yeah, ClinicalKey is super simple yet abundant, great experiences. So it's a positive response from the participant. Slide. Does ClinicalKey help you in making decision for your patient? So 50% say yes, but there is also 43% say maybe, because they realize that our decision is not not merely based on our searching. So this is about the knowledge. Slide. How often you use ClinicalKey features in your daily practice? So it's like a 20%, like a once a week, twice a week. So yeah, this is often. So yeah, this is like a once or two. Yeah, it's like a 1 until 3 times a week. This is quite good, I think, because like we use in the searching engine. So this is it helps a lot for the medical student right now. Slide. Could you find your answer quickly in ClinicalKey? 34% say maybe, but almost 60% say yes. Slide. Have you found some troubles during accessing ClinicalKey through single sign-on on UI or University of Indonesia? 62% say no. So, but there is 21% say yes. Slide. If you found troubles, tell me what are they. Okay, slide. The connection, that sometimes the website loads quite slow. Sometimes it doesn't come through with the login. I don't know that FMUI still have ClinicalKey or not. Okay, so most of them is about the signing in and the connection and something like that. Okay, slide. What should be improved in ClinicalKey to help you manage your patient? So the 31% is the accessibility. Yeah, because the connection, signing in, and everything in this area. And then the second place comes to, yeah, this same 15% is the self response, and then the logging in feature. So yeah, logging in the signing in. And then the purple one is the collection. So collection, I think it's very good. So but because it's too huge, maybe we need sometimes we need times to find our answer. Slide. Do you know ClinicalKey could access many free textbook? Okay, it say yes. So 56% say yes. It's very good answer. Slide. Do you know that ClinicalKey could access free journal or articles? So 81% also say yes, and it's very helpful for our medical student and residents. Slide. Do you know that ClinicalKey can be accessed outside from the Universitas Indonesia, even abroad? Yeah, yes, I already mentioned it before. Most participants know that. If you want to use ClinicalKey to manage your patient, what features that you will be focused more? So this is 37 and 31% say in the diagnosis and treatment. It's very yeah, very common. This is in medical students and also in the residents. It's very common to do these two things, because the how to diagnose and how to compare with another differential diagnosis, and then how we treat each of them. Okay, slide. Okay, at the end of slide, Yeah, it is a one slide before, please. Yeah, I give the participant to do some logging in, and then first their experience at that time, and then I want to know what they actually feel at that time. Okay, slide. Yeah, it's very useful, worthy, and easy to access even from handphone, and from mobile phone. It's easy to use because they have categorized the journal, guideline, book, and everything, because it's the ClinicalKey already separated them one by one. Easy to access, but a bit long verifying stuff. So logging in and signing in, because in University of Indonesia we have to signing to University Indonesia first, then come to ClinicalKey. And somehow we need to also, when we need to download it, we have to logging in with the Elsevier account also. It was seamless and easy to use. I can find various information, so very useful, fair to access. It's great. Slide, please. Okay, couldn't open remotely, easy to access but slow. Okay, drug monograph, it's so complete. Nice to see a better ClinicalKey view. So the most of them, it's a positive comment. Okay, slide. Okay, it's you can. It's I give some vouchers. Thank you very much for your viewing this quick survey. Okay, Ibu Putri, I think the survey and here, and we can have like a talk about
discussion.
Yeah, about the discussion.
Okay, thank you very much, Dr. Yasmon, for the survey and presentation. And it seems that from my conclusion is that most of the respondents want to use ClinicalKey in their practice session at the hospital. Yes. And most of the problems are the technical problems like connections and bufferings. And it's so unfortunate we cannot elaborate more for the usage.
Okay.
But what are your personal experience using ClinicalKey? How does ClinicalKey supports you in your practice?
Yes, actually, I found similar online resources or something like this. Not only ClinicalKey but also the other. I have like a ClinicalKey had a very specific in categorizing the type of our information that we want. It's very useful, not always in a term of based on the disease. So maybe we can search about the multimedia, we can search about the specific procedural surgery skills, for example, and then we for the guideline for the, so it's very good in the organizing of the insight of the content of the ClinicalKey itself. And I don't find it in another online resources. I think it's for my experience, I use ClinicalKey maybe 1 or 2 times a week. So, and mostly for textbook. So because in
like the Rutherford, it's
yes,
very useful. Yes.
Yeah, because it's our textbook in the vascular surgery.
Yeah, and they have the latest edition, the 10th or the 11th.
The
11th.
10th.
The 10th edition is right. So it really helps you when during the pandemic, as a surgeon, usually students and lecturers have their own hands-on practice at the surgery room. So what happens when the pandemic came and we have to face so many challenges,
yes,
especially in teaching?
Yes, During 2020 and 2021, it's very difficult for us as a lecturer to deliver our knowledge to medical students and also the residents. And yeah, because the time at the time, our offline methods, like a usual methods, is prohibited. Was prohibited. So we have to make a arrangement in the curriculum. For example, like a basic surgical course, we have to do in the online. It's very difficult, and then the medical students should, for example, this is not only in the basic medical surgery skill course, but for example, for inserting catheter, urine catheter. Yeah, this is the medical students should use like a bottle, like a mineral water bottle. They have to buy himself or herself in the catheter in the drugstore, and then they must we instruct by online. It's very difficult how they don't have the mannequin. We have to show in the 3D with the video. It's very difficult, but they made it. They made it, and 2021 we have the hybrid, and slowly we go to the offline. So it's very difficult to deliver the skills in the online. I think it's a very challenging.
Yes,
Dr.
yes,
Yasmon,
yeah.
I noticed that this was also one of your questions in the audience poll. Should we ask the audience about this as well?
Yes, but maybe in the next 10 minutes, maybe, if you.
Okay, sure.
Yeah.
Okay,
So,
sure.
Okay. Natasha, do you want to start the poll, or should I continue the questions?
You can continue the question. Sure. Go ahead.
Okay, thank you. Yes, so during the pandemic, you have to switch methods using online, and you have to instruct the students using online meetings, and they have to do it themselves. And they have to, yeah, like you said, for example, how to use a urine catheter, how to insert it, and how to correctly insert it. And
sure.
for that student, do they have to repeat the session again when it's now we have the offline session?
No, they don't have to repeat it in the offline session, but they have to repeat if they fail in the exam. We do like a, I don't know, it's more strict because it's online, so we have to do in the exam session for this basic practice for the clinician. It's a lot more strict, and we have to ask the theory very deeply, and then yeah, and if they failed, yeah, they have to do in the offline.
Is this a method became one of the challenging things that being part of your day during the pandemic, or are there any experience that you say maybe oh that's just some normal days, but are they any more challenging?
Yeah. Actually, during the pandemic, because I worked in the two hospital, and and then both of them is in the COVID-19 hospital, so it's very difficult to do in the too much work in the same time, and then this is very challenging, and we have to use like a level 3 the
hazmat clothes.
The hazmat, yeah, gown, yeah, that's very difficult because we have to go there, go here, and then make on and off of the hazmat gown, and then it's very difficult, and we have to do sometimes we have to teach the medical students and residents from the inside of the COVID area. It's very challenging, but it's good to have like the online methods in this term, because our University of Indonesia allow us to make some arrangement in the delivering the lesson. So it helps a lot with the rules.
So what are the challenges that you and other surgeons or residents facing in accessing credible evidence-based information at this moment?
Yeah, actually the one is always in the internet. It's very useful in the maybe from the search engine is very useful, and then from delivering surgery skills, it must be online. I mean, it must be offline, because at the time we do only emergency cases only for operating. So all of elective surgery was cancelled, or we postponed until the pandemic over. Yes, I think not the pandemic over, but until the situation is good. At that time it's very difficult, and then the resident at the time is very had a very low experiences in the surgery. So we have to teach now. Actually, is from the previously resident.
So the previous resident from the 2020 and the 2021,
sure,
they repeat and practice more offline in this year.
Yes, yeah. Okay. Actually, as the Natasha said, Ibu Putri, maybe we can ask about this, like my last answer to do the slide do.
Oh, okay. Yes. Yeah, I want to share something also, Dr. Yasmon. I know one of our student here, he was a general medicine doctor, but he is very active in social community. So when the pandemic came, in the social community, we usually have circumcision for young boys. For Muslim boys, usually we have a circumcision. And then when the pandemic came, it all came to a halt. And these unfortunate boys came from the lower economy family. They don't know where to go, because usually we have a social community
event. To do this and free, something like that.
Yes, it's free, correct.
And in the pandemic, it also came with our resident skills also.
Yes, and it helps them to practice, right? Because it's a small surgery procedure, if I'm not mistaken. But it helps them to practice. So he asked my help. Ibu Putri, do you have any colleague or friend or someone that you know that who in need of circumcision from a lower class family, so that I can help them? Because it seems that during this pandemic, they don't have any access to that facilities. So he provides that, and he helps certain families, and luckily we managed to help between 5 or 8 kids. And
Okay,
usually when
that
we
was
have a
very
social
good.
events, it's quite
Yeah,
good during
yeah,
the
yeah,
pandemic.
quite good. Yeah,
Yeah, because during the
sure, sure.
pandemic, we always have like 20 or 50 young boys
Yes,
to have a
and
second
it
session.
happens every month, maybe. Yeah, that's
Yes, it can
very,
happen
yeah,
every month now.
yeah.
And
Okay,
we make the schedule for this month. We have 2 or 3 kids in every Saturday, and then so each time the coordinator bring only 1 or 2 kids to the hospital, and they provide the healthy protocol like wearing a mask and have to be healthy and don't
sure.
have a fever, and
Yeah, yeah.
I can only be accompanied by 1 or 2 parents. Like usually when we have the social event, it will be very crowded with so many
Sure.
people.
Okay,
With
sure,
one
Bu Putri.
family will be accompanying this, one boy will be accompanied by 5 or 10 people of the family.
Yeah, so a lot of people comes if we our boys in the circumcision. Oh, it's it's
So
Yes,
already.
I
yes.
was just saying, while Dr. Yasmon and Ibu Putri are discussing, we have a
Uh,
question for the
Mhm.
audience. So from the experienced audience that we have here with us, what were your surgery lecturer strategies to overcome the difficulties in delivering
yeah.
surgery skills during the pandemic? So we see that one person responded offline for elective emergency. Any
Okay.
other participant, did they use offline for emergency cases?
Yeah.
So audience can actually answer this poll. They can just go to slido.com, or they can scan this QR code, and we
Yeah.
can let the
Please,
audience respond to this question.
please, all the participant, you can join us in the slido.com and select the answer that is shown here.
So we can share what are your experience in your country during the
Yeah.
pandemic.
Dr. Yasmon, we also
Yeah,
have a
Natasha.
question in the Q&A box. So Dr.
Okay.
Sukmawan is asking, I believe
Oh, I'm sorry.
evidence-based medicine practice will guide to the best quality of life for our patient. But as we know, in Indonesia, this evidence-based is lacking. Therefore, foreign country research such as US or Europe become our main source. But of course, it doesn't always match with Asia or Indonesia population. So what is your expert opinion about this?
I don't get the point, Natasha. Can I see the question in the chat or
in the chat Q&A?
In the Q&A box.
Q&A box with
On the tab answered.
Under answered.
Okay, yeah. I believe evidence-based medicine practice will guide to the best quality.
Yeah, because evidence-based practice always comes from the situation in their own country.
Oh, yeah, yeah.
And we
Sure,
have
sure.
the lack for the Asian or Indonesian population for
Sure,
the
sure.
surveys.
Sure, yeah, yeah. Actually, this is my also my concerning about this is my concern about this issue, because a lot of research, a lot of guideline and everything was made in the non-Asian country. But actually, if we want if we looked more deeply, there is also guideline. For example, from Japan or from Singapore or from Malaysia, from Indonesia itself has a guideline actually, or
from the health of ministry.
Really, but it's very difficult to find because we don't familiar about this. What we can do, actually, we can adopt, but we should remember about the resources of our hospital. So, for example, in the vascular surgery, if there is no endovascular treatment choice in our hospital, we can do the another choice. For example, the open surgery, we can do in the breast medical treatment with the medication. It comes along with the informed consent that should be give to the patient. So every choice that we made, we have to share with our patient, and it will with a good communication, it will helps a lot. So I think by the different the difficulties, I think the difficulties is we teach something very high tech or very very futuristic, but our resources is very low. But we have to teach it in our medical students, our resident, that there are also many options in abroad maybe, but we have to adapt with our we have to manage our treatment of choice based on our hospital resources. It's very depend of our decision. I think it's the answer.
So, Dr. Yasmon, as you can see on the screen, we ask our audience about usage of online resources for medical assistance.
Sure.
And you can see that 75% of the audience, they say Google. And only 5% say open access. But if it has to be evidence-based medicine, what is your opinion on this?
Sure. Google search engine helps us only for a superficial term. But when it comes to evidence-based medicine, we have to search in the good resources or reliable resources. We are, for example, the open access journal or PubMed or Cochrane that already cited and already reviewed by a lot of scientists in this world. So I suggest do the Google search engine or Yahoo search engine or Bing or something like that, only for nice to know. Not in the very deep searching. So it's very dangerous.
Yes, Natasha, if I may add, so for maybe not most people familiar with librarian. So we in the academic research, librarian helps our researcher, assisting them in searching the literature, and we give the literature review also, and we give them tips how to search and look in the correct resources. Like most people go to the Google first, and it's okay for a start, but we have to know when you want to find your specific information. It's like Google is like looking a needle in the haystack, right? You have to know what tool that you have to use. Do you want to use your hand to search the needle in the haystack, or do you want to use a scope? What do you say? Or do you want to use a pen, or do you want to use a magnet? You know, the magnet searcher. You have to use the right tool if you want to search for the correct information. So PubMed is an indexing machine. It's not a database full of full text journals, but not all journals in PubMed are available open. Sometimes you have to subscribe, and you have to look to your university access. You have to look to your university access so that you can know which one is subscribed by your university, and ask your librarian. That really helps. Your librarian will find you the right So your
Absolutely.
librarian will find you the right answer.
Definitely, Putri.
The right answer, and if they have the updated journal or the updated books, they will let you know. Just like yesterday when I asked Natasha, I gave her a spam with a, when is the Rutherford book is going to be online?
I'm sorry.
No, Dina. I'm troubling Natasha. Like you said, it's on July, but suddenly postponed until August, right?
So Gibu Putri, you do raise an important point that the librarian can play a very big role in teaching students about access to resources and showing them how to find the resources.
Sure.
But
And
Dr. Sorry.
Yes.
My question is that both to Dr. Yasmon and Ibu Putri, it's okay for students in the university to find time to come to the librarian. But when the students are in their residency in the hospital, they don't have time. Then how do we encourage those young residents to practice evidence-based medicine in the hospital when they don't have time to go to the library, they don't know where to search? How do we encourage those students to really change their behavior?
Yes, correct. Dr. Yasmon, maybe you can share the residents' experience.
Yeah, actually, it's not from the resident, but from the medical students. We have like curriculum inside of the curriculum how to search. So like how to know how to do the literature searching. And it comes along with our cooperation with another resources like Elsevier and everything. So we teach them how to do this. But unfortunately, it is for medical students from the University of Indonesia. But unfortunately, for the residents, they came from different university. It's very difficult. But for in the surgery itself, we also has a program, similar program, and it helps also the young resident to do the searching literature and something like that. And it's but it's very new for this clinical key issue is also new. So we as a lecturer should be more publish it and show how to reach the young resident. So I think the most important is the inside of the curriculum itself, Natasha. So if we want to do the right thing, so start from the curriculum itself.
Yes, from my experience also tells that when we collaborate with the lecturers, we managed to have a session for the medical students during the first semester. For the regular and the international class, we just have it recently on the early September. We have the health information literacy. So we facilitate them, we show them what are the resources that we have and how to use ClinicalKey, how to use Embase, how to use Scopus and others. We also help them to know that we have other tools like for reference manager or for plagiarism check. So they are aware of the facilities first. And then we give practice lessons. We conducted in maybe about 1 hour for a start. And I guess it's quite enough for them for 1 hour, because now our millennials generations are very fast to learn about online tools, correct?
I agree with Ibu Putri for medical students, but for the residents,
yes, I know they came from different areas, from Sumatra, from Kalimantan, from East Java, Papua also, and they have it's our challenges. They have different knowledge, level of knowledge regarding technology, regarding information, and they have also they have some burden on their shoulders that they came to learn, and they have to come back to their own area and to be a good doctor to help the villagers or the community in their area. So they face so many challenges, I believe, as a surgeon, especially during the pandemic, correct?
Sure, surely, yeah. But it's I have also this pool for teaching skills in surgery in your country. Have you experienced a fully online class? So 86% said no. So it's in the surgery skills, we have to do this offline, I think, because online procedure and everything helps, but maybe for only 10-20%, not more than that, I think.
So, Dr. Yasmon, in your questions,
yes,
you had included options like robotic surgery or virtual dissection. How do you think do you think those technology tools can replace live surgical skills training? What is your opinion on that?
Yeah, for the first time, I mean robotic surgery and then everything that's similar is only for the expert, I think. For example, but in the first young surgeon or first surgeon, it should be in hand off method, because it's very difficult to because I think our eyes and our hand, it has like a cooperation in the in how to feel, how to feel, how to when we touch, we can feel, oh, this is the firm, this one is hard, this one is soft tissue, this is the like it's difficult to find it in the to feel it with the robotic.
Do you experience it in Germany when you took the PhD?
No, for robotic, no. I have no experience about the robotic surgery in the vascular surgery, because it's very challenging and very difficult. Because in the vascular surgery, there is a minor surgery that can be done with the robotic, so it's not quite improved.
Right.
Like that, Natasha, I answer. Oh, this is the please.
Actually, Dr. Yasmon and Ibu Putri, we have one more question from the audience.
Okay.
And sorry, no, they sent it on my one-on-one chat. So the question is coming from Dr. Yasmon's survey. The survey showed that most of the respondent, they use ClinicalKey for diagnosis and treatment. Are you able to share more on how they used ClinicalKey or any other resource for diagnosis or treatment? So what kind of information they look for, how they arrive at diagnosis, treatment? Any comments on that?
Yeah, actually, I came in this conclusion when we medical students very I think medical student is not yet a doctor, and they think like a normal person. I mean, the doctor is a normal
They're
person.
They're not very familiar with medical
not familiar
term.
with medical term, because when we do when medical students had a maybe one symptom or one signs, they in their mind, they have a very huge differential diagnosis. And it because of the experiences, the learning curve of experiences, the different diagnoses get came like a
very
more
specific,
come narrower. So as long with the experiences, the differential diagnosis came in the very specific working diagnosis. This is the difficulty of this is the I think this is how medical students search the literature. I mean, this one maybe in the how to find the good working diagnosis from my differential diagnosis. So this is and for the treatment, I think it comes because they have no idea about the treatment for in this disease in a very because the Cipta Mangunkusumo Hospital, our hospital, teaching hospital in Indonesia, in University of Indonesia, it's very top referral hospital. So if they answer like it's like a simple answer, so the lecturer or the consultant is not yet, so not satisfied. It's
it needs to be complex.
Sure, yeah, it's very I think it's very
should
difficult
be very detailed and complex.
Detailed and very good and advanced and
with a good reference.
Like in a good reference, something like that. So it our medical student has this burden, Natasha. So maybe this one, the treatment and diagnosis, should be very good answer.
Yes. Yes, because ClinicalKey has the guideline tools and also the patient education. I like the patient education facility because from my own experience, my second child, on the 2010, I was having my second child, and he was born with microtia. He was born with microtia, and at that moment we don't have ClinicalKey, so I only browse using internet and using PubMed. But then we subscribed it on 2015, if I'm not mistaken, and they have this patient guideline. Patient. I forget patient
education.
Corner.
Yeah, patient education. And they have a very simple and understandable language to tell me what is microtia, what do you need to do, what you need to learn, what do you need to be aware of, and what are the complex or what causes it. And it's a very simple language, and I believe some doctors, when we go to doctors, they know the medical terms, and we as commoners, we don't know and we don't understand about it. And it's very useful for doctors to read, and they can use the language at the same level as their patients. So that they can also achieve that patient safety is not only about they got home safety and be cured, but also they feel at ease. What are they concerning? What are they experiencing? I'm having this disease, and the doctor is explaining in a very common words. It's very calming, especially for patients, and it can also increase 20% of the patient's health. And because psychologically they will feel at ease because they understand what their doctor was saying.
Yeah, I agree. Yeah, I can very well put
I really like the patient education, and I tell the medical students that if you don't understand the medical terms that you read from PubMed or from the journals or the textbooks that they have, you just read from the patient education section, and it will, because some of the students they don't have a high level of information skills, and most of them they are from the most of them from the public school, so they're not familiar with English terms and medical terms. It's very new for them. So sometimes I give them a shock therapy. I show them the procedural surgery for the microtia, plastic surgery, and they get scared. They go, oh my god! That's a new experience for them. It's very new experience, so that they know this is the risk for them if they want to become medical doctors, or if they want to be a surgeon. This is the one that you have to face every day.
Exactly.
Okay, this is I think I want to know is in your country, was there any big differences in surgery teaching before, during, and after a pandemic? So yeah,
Yes.
the 100% say yes.
Yes, of
So
course.
definitely, because in the surgery teaching it's very difficult, and definitely there is no there is no not 100% offline at this time. For example, until now, we still do the hybrid session for surgery teaching. So yeah, it's very challenging, I think, Natasha.
Of course.
Sure,
So
sure. Okay,
in
it's
the
like
in the interest of time, we'll conclude the session with some
sure.
final remarks from Ibu Putri and Dr. Yasmon. So Ibu Putri, Dr. Yasmon, in this session on evidence-based practice, how do we encourage both doctors and students to really adopt evidence-based practice in the teaching hospital, in the school? How do we do that? Some concluding remarks from you both.
Okay, please, Ibu Putri, you first.
Okay, thank you, Dr. Yasmon. In my opinion, you should ask your lecturers, ask your librarians, and search for more information. And in this pandemic era, we have limitations, but make them as challenges for us to grow more. And I believe when people grow together, we will strive together.
Wonderful.
Thank you.
Well,
Please, Dr. Yasmon.
Yeah, and for me, we have to know with the basic knowledge first, and then go deeply. And it helps. It can be helped by doing the good searching literature and with the reliable sources. So first of all, you have to know your you have to know the your best effort in the basic knowledge. So because this one is the basic knowledge is very yeah, because it's basic, so you have to do the best effort to do this, and then go deeply, and then in the you will success in the everything evidence-based medicine. So I think it's my answer.
Thank you, Dr. Yasmon.
Yeah.
In that case, we'll conclude the webinar for today. In summary, we heard from Ibu Putri and Dr. Yasmon on why evidence-based practice is important. We talked about the challenges in surgery and skills teaching, especially the challenges related to COVID pandemic, no access, everything has to be online. We talked about those challenges. We talked about some strategies like using circumcision or maybe using emergency surgery as a way to allow surgery teaching. We also talked about how to encourage students to practice evidence-based medicine, and Ibu Putri shared about reaching out to the librarian, asking for information. Dr. Yasmon talked about starting with the basics and then doing more information search to find the right evidence. So I thought this webinar was very useful for us to understand how we can start students on a journey to evidence-based medicine. I thank you, Dr. Yasmon.
Yeah, you are welcome.
Thank you for your insights. Thank you for conducting the survey in your institution and sharing the findings about ClinicalKey. And thank you, Ibu Putri, for sharing your perspective on how librarians can also support with evidence-based practice. I would just like to also thank our audience for your time and your attention. I hope you found this webinar interesting and useful, just like me. Please do leave your feedback. You can scan the QR code, or we will share the link to collect your feedback after the session. The session slides and the video will also be shared with all the registrants. Once again, thank you, Dr. Yasmon. Thank you, Ibu Putri.
Thank you.
Thank you so much.
Okay.
Thank you.
Bye-bye.
Stay healthy,
Bye-bye.
everyone.
Thank you so much for sharing. Thank you.
Okay. Good afternoon.
Bye.